Hey, what's happening?
Anyone need a doctor after that last segment to
Need a veterinarian.
or something?
Good to see you.
What's
He's
up, Dr. Koushik Shaw?
Hey, how are you guys?
We're hanging
right.
out,
Good morning.
partying, doing all that kind of fun stuff.
Man, I was a little afraid to follow up on that last segment. It was a little.
Oh no, that's not real. That's all in the script.
Oh man.
That's all in the script.
Don't you start.
Oh, I got a good.
I've got more in me.
I got a good
I'll
question.
Let you have it, too.
As a
I-
urologist, aren't you used to getting panties out of a wad? It
about
feels
to
like
say.
you should be fine with that.
Are you still on the testosterone? Do we need to dial that
I'm not.
back
You
down?
never
Could
would
you
let
be on too much?
You wouldn't
or-
let me on the testosterone.
Yeah.
I think it's an estrogen deal.
No, I see. I'm the bad guy again.
No, people are just
No,
trying
I
to
have a
bring
good
some levity
question.
into the.
I have a question.
Do you
Okay,
get angry
sure.
if your staff? You have to be on call sometimes.
Well, you know what? I gotta say. So I was listening, and in your whoever's defense and offense here is when we, I start my day today. I've got patients I have to see. I'm in the operating room. We've got labs to follow up. It's not a show, but it's like a show.
That's
Right.
the problem.
On every
That's the
day.
problem. You have patience. I have no patience.
and there's a lot of preparation that goes into it.
Right.
So we tee off that day.
Yeah,
and
but
it ends well. And
If your preparation goes wrong, somebody loses a ball or dies.
yeah, our little thing that we say about our practice is that we take what we do seriously. Maybe we don't take ourselves so seriously in the process, but we have some fun with it because it's urology.
Right.
But what we do is we take that part seriously.
All right.
for sure. So,
Listen,
yeah.
we need calls not about my behavior or about
I have a
or-
timely
or-
question too.
or about my producer situation. Let me get the plug in here to get people calling.
Yeah.
We won't yell at you. 512-834-0937. Call if you have any questions about men's health, or even, you know what, we need to not always just make this exclusive about guys, because Dr. Shaw does deal with ladies too who have issues, right?
Urinary tract infection, incontinence, kidney stones.
Say if
blood in
a
the
woman's
urine.
on a treadmill
Hey,
and
you're
she begins to
dealing,
wet her pants.
That happens, man.
Yeah,
Yeah,
it happened yesterday
this lady
to
named
Amanda
Dudley wet her pants yesterday in working out.
She coughed while working out, and
It happens. Yeah, women, a lot of women avoid trampolines for this. Very
Now, was
reason.
that- do you
I'm
think-
serious. There's a whole. I can't get on a trampoline with my kid without peeing in my pants.
Could part of
so,
that be because she had a hysterectomy last year?
hysterectomies can happen.
Childbirth.
You're stretching all the ligaments down there. And what happens?
She probably
is,
got it stretched out by her husband.
if you
Sure.
put it, what hole are you? Yeah, do you know how the anatomy works? That's not.
I knew it was tight. It was weird.
Yeah.
silence.
I am so sorry. I yelled.
I'm so tired.
I get it's the part that where it fires me off is not the issue. It's the excuses about something else, which I know is Daniel's defense mechanism.
I know. We started upsetting you, but I didn't think you were actually that upset because I saw you do like a wink and so I thought, oh, you're firing this up for air, and then at some point it became very real for you.
Yeah. Go ahead.
And-
Hold
Let
on.
me-
You guys talk to Dr. Shaw.
Let me kick off with the questions, Dr. Shaw.
phone number is 512-834-0937. Don't be afraid to ask any question. They've all been asked. 512-834-0937 before, and I'll give you an example. I've called Dr. Shaw twice because my nuts were twisted. I thought they were twisted, but I had a
Turns out you were just mad at your staff.
I almost said I was going to. This is something you can laugh at. I had an episiotomy, but that's not what that is. That's what when they cut your wife when she's having a baby. I had epididymitis
right.
Yes.
twice.
I've
Yes.
done that.
I remember
Yeah.
with that clinic we set up in.
And no, he won't.
At the KLBJ.
He won't
site.
give you a
He did the
narcotic painkiller, but he will give you an antibiotic.
Dr. Shaw, I called
You're
you.
better now.
I called you last summer, as you know, from my vacation in Nashville with a little bit of a problem that I
right.
think happens to a lot of guys in the summer with the heat and the sweat and the driving around and the tight pants
right.
and the.
This is like the 1 year anniversary.
This was the most painful thing that I've ever had happen to me on my body,
Yeah.
as far as physical burning pain. There was
you
nothing I could do for 2 days.
Did you get the jock itch?
Yeah. There was nothing I could do for 2 days to even squelch that.
Is that a fungus?
But,
Is that what that is?
Pain.
Dale Texan calls me on a regular basis. I was
So
like, I
what
don't
can
hear
guys
from you
do?
very
What can
often,
guys
so
do
I
in
knew it
the
was
summer
serious.
to protect themselves so that that doesn't happen? What is it exactly?
See, Daniel, I even called Dr. Shaw in the
balls?
afternoon.
Yeah, well, but it becomes something else, doesn't it?
Yeah,
It's more than
so
just sweat. It's
basically
it never happened
is
to me before.
like a fungal dermatitis. What
Okay.
happens? So you're sweating down there, and especially it's in the summer, and you got a lot of guys, and plus you got a lot of guys. Your FedEx guy, your air conditioned dude, your plumber, everybody. And stuff happens there. So, two things I would say, or a couple of things I would say is number one is you probably should shower twice a day if that's the case. Morning and
But not
afternoon,
bathe,
evening.
right? Because you don't want to keep that area wet for too long. I'm talking about baths versus showers.
Yeah, baths versus showers. I think less guys tend to do that.
Right.
But in general, if you do bathe, shower first, then jump in the tub, because otherwise you're just sitting around in your own stew of bacteria.
Gotcha.
So, but what happens is, you get the sweat down there, you start scratching it down there, you start breaking the skin barrier down, the bacteria kind of gets into the skin layer, and that leads to more inflammation and scratching, and then you just you get in a bad sort. So it's usually keeping the area dry. Shower twice a day, keep it dry. That you could either use talc or some sort of cornstarch powder. Some people do stuff like that.
Yeah, your
to keep it
people
dry.
would use cornstarch.
And then sometimes a topical antifungal cream like a Lotrimin or so,
yeah.
something like that. That would be
Spray.
helpful as
Okay,
well.
because it's man, I don't wish that upon anybody.
Here I go.
Is
saying
this
some-
who's this?
That's
a guy?
Chewy. That's our
that's a
Chewy.
strange.
Okay,
That's Chewy.
He's
okay.
fine.
He's good.
All right.
It's security.
Is
He's,
he?
he,
No, I thought he was a
No,
guy
no,
with
no.
sweaty
No,
balls.
no.
He
He
was here.
I don't think they're sweaty.
He heard there was a job opening and he just rushed right over. Here's one I shouldn't confess. So I started itching a lot on the right side of my crotch,
Right.
between the balls and kind of the leg taint in there,
Yep.
and it still does a
Why
little.
one side, I wonder?
I don't know. I'm going to get to the
Yeah.
embarrassing part. I reached down there. I realized there was a skin tag, like right where my leg connects to my body.
Right.
I pinched it off,
Nice.
and then I ate it.
Chewy, huh?
No.
You know,
I pinched
put
it
it in
off.
chili.
Should I go in? Should I be concerned about HPV and that being a sexual?
Sometimes it's a skin
tag?
tag. Skin tags are common, and it just kind of looks like it's just a little.
But it was itching too, and it was kind of.
Yeah. But an HPV, like a wart lesion, if you kind of magnify, it looks like a little cauliflower type of thing. Is what the deal is. If it's kind of got that surface, you can use a topical cream to make those go away. They have those at Walgreens.
But my
and
question
CVS.
is, could it have just been a regular skin tag, or should I go get checked?
It could have been a regular skin tag, but you should get checked. That makes sure there's not any more.
I'm pretty sure I have
Not
HPV.
anymore?
No. But I know I have HPV. I had it in the 90s.
Okay.
So listeners, don't sleep with me.
So, but cryo for the guys that are listening out there, you could also freeze it off, cryotherapy with a dermatologist,
Or you can clip it off with a toenail clipper.
Or if they're more significant, you can excise or remove them. If they're on your penis, by the way, seriously speaking, I've actually seen two of these guys in the past year, and I haven't seen any in a little bit. But the warts on the penis, if they're allowed to stay there and grow bigger and bigger, they can actually set you up for penile cancer. And
But
that
what
can
if you
actually kill you?
But what if you get a
Yeah.
wart that's bigger than the penis and you're proud of it?
I've seen that in my career, and it's pretty bad.
All right, listen,
Yeah.
there's some calls coming in.
So
the
size
other
isn't
thing, too-
everything, yeah.
And the other thing, real quick, guys, is if you have warts on your penis, to get them taken care of, they can actually lead to, potentially setting your wife up or spouse or girlfriend for HPV. Which can lead to cervical cancer. So all sorts of bad things can happen. So if you got stuff like this, go get it taken care
Caller,
of.
I don't know your first name, but it says you have a question about a vasectomy. Caller?
Yes, I was curious that I had a vasectomy a couple of years ago after I had my second child, and do I need to go in regularly, like yearly, for count checks or anything like that, just to make sure nothing is reversed?
After you had your vasectomy, did you ever get a check to make sure it was at zero sperm?
Yes, they did.
Okay.
It was a few weeks afterwards. Yeah.
Yeah. So if it's zero, you're going to be zero far out. Everyone uses slightly different techniques, but the big thing for the guys out there is that you get your vasectomy done. There are a few 100 million sperm in the pipe still after you get a vasectomy. So it's probably about 30 plus or minus ejaculations to clear the pipes. Once you're 0, you tend to stay at 0. And again, everyone's got different techniques. There's these scary stories where the tubes grew together or other things happen. In our practice, we haven't seen that, but once you're 0, you're
You
0.
use tiny steel clips, don't you?
We use tiny little titanium clips.
Titanium
Each one is,
clips.
the size of a grain of rice on either
Right.
side. Plus, we remove
As opposed
a
to what,
segment,
cauterizing?
plus, we remove a segment in between.
Right, okay.
Plus, I use a little heat to cauterize.
Oh, okay, wow.
So
Okay.
we kind of do all
Triple.
of that to kind of make sure that things don't.
It's called the Dr. Shaw triple play.
So the triple.
That's
I
what
like
he's
it.
known
Yeah,
for.
I like it. I like
Yeah,
it.
it's like when you go to Chili's and when you go to the apps and you
Right.
can get the sampler platter.
You get the Shanghai wings and
Right, the clamps
egg
are the
rolls.
southwestern egg rolls. The cauterization is the artichoke dip, and the wings is taking out the segment.
It's a lot of value.
Love it. Hey, I was gonna tell you guys it was really cool. I went to that the Moon Tower Comedy
Uh-huh.
Festival and saw you guys, and I see you guys in this environment. I've seen y'all offline.
Right.
It was really really cool and neat to see y'all in
In
a
the
different
wild?
environment, in the wild
In the
with
wild.
your bros,
Right.
the fellow
Stage.
comedians, and it was really really neat.
Cool. man.
Thanks, man.
Yeah.
Well, Matt's the only
You guys
official.
clean up all right, too.
Matt's
Yeah.
the only official
You know?
comedian here. But
Oh, we try.
No, that's
Yeah,
not true.
It
I
was
was a comic once.
it was
Comedian is
really
just
neat.
being funny, and you do a great job at it.
Brandon.
Hey, how you guys doing?
Good,
Hey, man.
good,
Hey,
sir.
Brandon, what's up?
Hey, I got a question. It's kind of broad. I'll try and narrow it down as much as possible. What is your opinion on testosterone supplements? More specifically, something called Nugenics. I'm sure you've heard of it with your patients before. I just want to know your general opinion on them as opposed to testosterone shots or doctor prescribed.
Nugenics.
Nugenics, yes.
All right.
Yeah, so we're actually gonna
He's
look
saying,
that
can you
up while
pull
you're
it?
talking.
Oh,
while we're
we don't
talking.
have. We're not on the
We'll see
line.
if we can
I'll
do
pull
it.
it up. I'll pull it up.
So the big thing is, how old are you?
I'm 20.
20. Kids? No kids? Want kids?
No kids. I actually work in the supplement industry. That's just why I wanted to get a doctor's opinion over this kind of stuff.
Yeah, so my big thing, and we're actually looking it up. There's a lot of products out there. The big thing is, that we try to preach is, the diet, exercise, vitamins is needed. But one of the things here, we're checking it out right now. So, Nugenics, confidence, vitality. What do you want to tell me what's in it?
Oh, gosh. Anything from yohimbe, horny goatweed, D-aspartic acid, I know, is one of the bigger ones. Possibly DHEA.
Yeah.
I don't know the ingredients right off the top of my head.
Yeah, the big thing is, the B12 is great, B6 is good, zinc, sure. There's something called testofen, which comes from fenugreek, I'm reading about. The big thing is you have to be a little careful, especially because some of these supplements, maybe not this one, they can actually sneak testosterone into there or DHEA and things like that. The problem I sometimes see, and I'm not going to say it's this particular, a supplement or not, but what happens is you fast forward, you're 25 or 30, and you get off of these things, and what happens is physiologically, our testicles make testosterone, and what happens if supplements sneak in testosterone, the testicles stop producing their own or reduce their own production of testosterone. So what happens, you become this 25, 30-year-old guy.
And you create a reliability too early in your life.
The testicles shrink. You end up with little squirrel balls. And what happens is now you need to be supplemented with testosterone because you no longer make your own. I've seen some guys with permanent or semi-permanent fertility changes and issues with infertility. And some of these guys, I've got a handful of guys, I actually had to throw out my hands. I couldn't correct them anymore. They had been on supplementation for so long. So I would say to you and all the guys out there, just be careful about what's in these supplements. Try to go natural as possible in terms of diet and exercise.
Excuse me, did I hear somebody talking about squirrel balls?
Yeah.
Is Mr. Grumpy finally gone? Mr. Chair throwing big baby? Me. I didn't get an email. Me. Just give the tickets away, you pussy.
And some of these guys, it gets pretty sophisticated.
Right.
Where some of the guys that are on testosterone, they'll end up taking estrogen blockers or aromatase
Right,
inhibitors
right, because-
to block the overconversion, so you don't grow boobs. And it gets rapidly.
Yeah.
You kind of get into
It's
dig
complicated.
yourself into
Yeah.
a hole. And it's cool when you're 20 and you're working out and the chicks dig it. And then you're 30, 35, and you're dealing with some consequences, and that's the challenge. That I see.
Brandon, enjoy your 20s. It only gets worse from there.
Enjoy, buddy.
All right, thanks. Hey,
I'm not taking them myself, but
Yeah.
I did have just a general question.
Yeah.
Yeah,
But
all
good
right.
question.
Thank you,
But
guys.
good question.
Thanks,
good
Brandon.
question.
You always have to pay the fiddler at some point. That's what you're kind of
I
saying.
think you pay the piper.
Pay the piper?
Yeah, the fiddler works for free.
Oh, that's nice.
512-834-0937. If you have a question, we're going to do a live spot here. And then if I had a major, one of those things where you go, oh, that would be a great question.
then you
and
forgot
then
it.
just disappears during the thing. You were talking about squirrel balls, and then the dumb squirrel interrupted, and then you were talking about testosterone.
Does it have to do with sex?
And,
You were talking about things on your.
I'm something I'm going to bring up. Especially this time of year, super hot, guys out working in the sun a lot, where we've been getting up over 100 a whole bunch. When you don't stay hydrated, you can end up messing up or creating other problems for your urinary tract. Is that true? Not true?
Yeah, that's super important. Brendan actually hooked me up with some water here. He's like, stay hydrated, doc. So the big thing is that I see is kidney stones during the summertime, and it's twofold. One is that you're losing a ton of water through sweat. And if you're working at a desk, it's one thing, but a lot of us are outside, so you get dehydrated. And then the other big thing is, this fellow who just called in, a lot of people are doing like sports drinks and monster drinks and Cokes and teas, which actually dehydrate you because it's got the caffeine. So you're peeing more, you're getting dehydrated. For whatever reason, it's hard I don't necessarily understand this. Of all the cola drinkers, Dr. Pepper's the worst in terms of kidney stone formation.
Really?
But the dark colas are really bad because they can actually set you up for kidney stone formation between the acid and components of it. It drops your pH. It makes you urinate more. All of those things. Believe it or not, the clear colas, the 7-Ups and Sprites, the thing about those is they actually have the citric acid in it and the citrate. So lemon... what's in lemon, the citric acid basically complexes with calcium, keeps it from sticking together and
helps
and
break.
forming a stone.
Okay.
Yeah.
Oh, wow.
So hydration is really important during the summer, and somehow you can get a hold of either fresh lemons, or if you need to cheat, it's that real lemon stuff, or it looks like a little hand grenade, that little yellow, looks like a little mini lemon. Squeeze a couple drops in your water. That's really good during the summer. And your urine, if it looks like orange juice,
If it's dark,
underhydrated.
you're underhydrated.
Yeah. If it looks like water, you're probably overhydrated or drinking too much alcohol.
Right.
Right. The gates are open. It just
Right.
go wash it.
So it should be
look
pea
like,
colored.
It should look like lemonade. It's like a light yellow
Gotcha.
is the ideal. Yeah.
And you now, just a reminder, everyone, you now need a permit, even if you're a child, to have a urinade stand.
Yeah.
Just everybody
You wouldn't
remember.
let me on testosterone, remember?
I forget what was going on.
I had to go
He'd seen you throwing a chair in here.
I had to
so-
go to that endocrinologist and take all those blood tests and stuff.
Yeah.
So,
Yeah.
no.
We need to revisit that.
Yeah, I don't
That's
know. It sounds from my behavior in the previous hour. It sounds like I have plenty of testosterone.
But having said that, we should recheck those labs and make sure it's all settled out. So,
Yeah, let me see. Somebody's been on hold for 14 minutes, and for some reason, the software. I'm sorry to keep you waiting. I just didn't know. I couldn't see your name or anything else. So, good morning. Good morning to whoever I'm talking to. Hello.
Hey, this is Jeff. Hey, I got a question for the doctor.
All right.
I'm a 55, and you described it. I feel run down and low sex drive. But a few years back, I tried the testosterone cream, and it didn't really do anything for me.
Right. So we have a whole panel of things that we check. At 55, we do a diabetes screen, check your thyroid function, vitamin D. We'll actually check your testosterone as well. So your testosterone, talking about 20s, is about 600-700 when you're in your 20s. It's about a 1% to 2% slide every year after that. Talking to Brandon over here, just had a kid. Your testosterone drops with stress and lack of sleep, and it goes up and down a little bit. It's higher in the morning. That's why there's the morning wood, lower in the afternoon. So there's all these things that change. But so at 55, we would do kind of a metabolic screen on you, just kind of make sure everything is fine. The testosterone gels are out there for sure. We use those periodically. My experience with the gels is that they were variable. Some people hyperabsorb the gels. Some people didn't absorb very much. It was a real challenge. So we sometimes use a medicine called clomiphene.
That's what I'm doing.
Yeah, which
and
is a pill.
I've had pretty good success with it. My numbers have been better, but I haven't noticed any side effects. So
Yeah, it gets you to make your own testosterone.
I don't have any
No, you're
boobs,
looking
do I?
cut, man. You're looking good.
Is that why
And
you're?
it's also we got to point out to the callers too that the testosterone isn't a magic bullet, right? If we're wearing a belly and doing lots of fast food and drinking more than we need to at 55 and not sleeping, you can't just rub a cream on and then feel 18 again.
Having said that, everyone comes in and asks for what it was like. But doc, just give me the testosterone.
But if I'm if I'm masturbating twice a day, this isn't a joke. Do I need testosterone? Does that have anything to do with your sex drive?
Testosterone definitely helps with libido. You know. But to your point is a lot of guys come in with a beer belly. I'm working 3 jobs.
I'm right here, dude. I'm right here.
Right.
I'm right here.
And I was like,
Koushik.
and I don't have any libido. My testosterone is low. I haven't never exercised. You know.
Right.
So to your point do what you can in your own wheelhouse, and believe it or not, every extra pound is another 1-2% of testosterone. Believe it or not, the fat takes your testosterone, converts it to estrogen, and that's why bigger guys tend to have breasts.
Well, that was my question.
Wait,
You
wait,
got it.
really? All right,
You got it.
here we go.
You got it. You got it. So
So testosterone is not the end all be all.
So that I wouldn't need a Percocet every few weeks or so whenever my discs act up, and now my knees. This is all verifiable. Well, that's not the only reason I wanted to get high, but I've started smoking weed again.
Okay.
Illegal marijuana, and for a while I wouldn't say anything about it. Small amounts. But I was sitting there thinking, I remembered in the 90s when I was pretty thin, I started to get the gynecomastia. Now, am I putting myself at risk again for more? I mean, I already got one massive.
We've all heard
man
about
boob.
pod boobs,
But
right?
am I putting myself at risk again for that with smoking? Because it really does help with the pain, regardless of what the government wants to say. It's amazing for back pain.
Yeah, well, smoking weed, there's definitely an association of that and gynecomastia. Not everyone that does it gets it, but it's definitely out there.
So if I had it once, I may get it again?
Yeah.
Now, does this mean you socially won't go out with the wife and I now that I've admitted that I'm doing an illegal substance?
Well, he may be a boob guy. He might be
you
into
get
it.
like a nice 8-cup, I'll hang with you.
All right, let's go
So-
to...
Do you think it's the things that come along with pot smoking that make the boobs, not so much the
Is it
pot,
the-
like
is it
sitting
the
on the
Cheetos?
couch and eating
It's
snacks
Cheetos,
and, I mean...
That's a good point. Is it?
I mean, I
all
don't
the
know.
Here's what I'm
lifestyle?
doing.
Who
I
knows?
literally wait till the end of the evening so that I don't get the munchies, and I smoke as much as I can before I go to bed.
sleep.
And I feel as though if I go to sleep right now, I'm going to figure out all of the world's problems. It's almost like an ethereal thing. I drop to sleep, and I never figure out the world's problems. Why are you shaking your head, CJ? What's...
I've tried to do that for sleep, and then I lay there for 3 hours
Oh, no, I
wondering
don't.
if I'm
I
awake or
crash.
if I'm asleep
No,
or if I'm dreaming. It just makes me nauseous.
I completely crash. All right, Ray's been on hold for a long time. Ray, sorry to keep you waiting.
No problem. Great to talk to you. I've been listening to you since the 80s.
Well, thanks. Sorry you had to hear today's show.
I just wanted to ask, I tried to explain it to your phone caller.
Screener.
Screener, thank you. I had a...
The Dremel tool stuck up your rear end. That's a Dremel tool, right? What's that sound?
I'm sorry. Hold on a second.
Oh, great. I shouldn't have asked.
Yeah, why?
Can you hear me better now?
Oh, much better. It was a real high-pitched sound. Go ahead.
Yeah, I had a partial colostomy about 1.5 years ago, and ever since, I also have a hernia because of the operation. But basically, I'm just wondering if he can tie any of that to I am not ejaculating during sex. Nothing's coming out.
Why did you
I
have
feel
the colostomy? Like, was it colon cancer?
Well, it was a virus. It was a, what do you call it? It wasn't cancer.
But they removed part of the rectum and colon?
Yes.
Rectum?
Did it happen? Did this happen after that surgery?
Yeah, ever since then.
Yeah, there's nerves that are back there behind your sacrum, your sit bone, your tailbone, and that's where they're operating, and some of those nerves more than likely got affected in the process of your surgery. Sorry to say, and that's where that will affect ejaculation, and it may be permanent. Sorry.
Sounds like you're saving on paper towels, though.
But hopefully you've got good erection.
But you can still have an orgasm, right?
Well, I can feel it. You know, it feels like I'm having one, but nothing is actually
coming out.
Yeah.
Coming out.
No more kids, man.
You sound like a woman's dream.
Yeah. Sounds like my wife would like to
get your number.
Give you.
Keep the sheets clean.
Thanks, man.
Got a prostate the size of a honeydew and a head full of bad
I know
memories.
you didn't know where that guy was going with that call, but do you realize a man called to say that he had a colonoscopy and colostomy, and before he got there, you said you got a Dremel tool shoved up your ass.
That noise.
But he literally did.
Yeah, he did.
Yeah.
Well, I'm a bad person. That's why. I've told you that method I do occasionally. You never heard of it before, remember? And I remember reading about it in Penthouse as a kid. And
where you press on your taint to
coitus,
keep the...
It was coitus interruptus when you right at the right moment you press as hard as you can on your prostate. And now used to when I was younger, nothing would come out. Now I'm older, and the prostate says, "Well, you know what you're trying to do, and it'll." You know what I'm saying? But you'd never
You're trying
heard
to last longer.
But no.
What you're doing.
No.
What are you doing?
To keep, I'd read about it as a birth control method many years ago. As a teenager, I read about it.
Okay.
Where at the point of orgasm, you press as hard as you can on your prostate, and nothing will come out.
Yeah.
But it doesn't work so well now that I'm older.
Yeah.
But you'd never heard that term before.
I could see so. Yeah, but you were also like, did I hurt myself or something? Right?
Yeah. Was it dangerous?
Yeah.
Well, let's do one more here, and then we got to get out of here. Oh, and I have a big question for you. We came up with our creative meeting the other day, and that involved your appearance next month, or August, I think. When's Prostate Awareness Month?
September.
Okay, hang on. Sean, how are you? What's up?
So I contracted HPV about 14 years ago. It got so bad that I had basically a cauliflower on my anus.
Yeah.
And had to get it surgically removed. And everything's fine, and never gave it to my ex-wife at all. But just recently, about 2 weeks ago, my girlfriend tells me that she might have gotten HPV. Totally scared the crap out of me, and does that mean I'm still going to have flare-ups to where she doesn't have it, she found out, but am I still going to have flare-ups even though there's still no sign of anything on me?
As long as they excised it completely, you should be fine. But there's a viral component to that, and it's one of the HPV. It's a very successful and common virus. It's out there,
and it can be dormant, right? Yeah,
dormant in a lot of people. So it is one of those things where you potentially still could be a carrier, and so you just always have to be on the lookout for any new lesions or anything like that, and get checked regularly.
All right,
Sean. Thank you very much. And, of course, you can go to Dr. Koushik Shaw's website, which is skipping my mind right now because I'm thinking of the other question I want to ask.
AustinUrologyInstitute.com.
And the number is 512
694
8888. I almost gave you the number to Cap City Comedy Club.
For Pizza Hut.
Would you like to come in September and do free prostate exams for maybe 35 minutes to an hour?
Do we set up the KLBJ tent? We use the
banners,
banner sign and do that?
Oh, man.
Only if we do it like that.
No, I'm saying,
but
is it? But will it violate any of your rules if people come in off the street to do it, or will they need to sign a waiver?
No, I mean we do that at the hospital.
Okay.
There's no reason.
Dr. Shaw goes up to random people and just gooses them.
When he goes up random people?
Believe it or not, we've actually there was mobile screening. There was book vans back in the day.
We'll book that then. We'll do it.
Showed up.
We'll do a free prostate exam.
It's called the ass van.
Now the difference is we're going to have a microphone inside the tent.
But let me tell you a funny story about that. It was a September day in Austin. It's hot. You're doing a prostate exam, and some guy hadn't had breakfast or lunch. Do his exam. He passes out, followed by EMS showing up to the little van and scared off of the other half of the guys in line.
It can make you pass out?
No, I mean it's rare, but I'm gonna tell you, September.
I guess if you've
110
never,
degrees,
was it his first time? Was he a virgin?
It must have been. But anyway, we went from 35 people in line down to one. And
Oh,
then,
well, saves on the rubber glove
No,
budget.
But early screening and detection, PSA, rectal exam. Having said that, no one likes it, but it's one of those things. If you get diagnosed and caught early, it's treatable, it's curable. You move on.
All right, we'll do that then.
So,
we'll do free exams. We'll start with the building. And I'd like to mic all of management as they're in there. All right, Koushik, thank you. Sorry
Very
you had
good.
to hear me yelling. It's part of the show. Have a good one. It's Dr. Koushik Shaw, Austin Urology Institute. And we need to mention the vasectomies. You can do them almost any day now. And there's no needles, there's no pain, no reduction in sexual function. It's AustinUrologyInstitute.com. Thank you, sir.
Always appreciate you guys.
Thank you, sir.
Always appreciate you guys.
Thank you, sir.